I mean, what we have seen, and that's the good news, is that severe symptoms and mortality has sharply decreased over the last couple of months, at least in the Western countries. So from this perspective, even though we see the Delta variant now spreading quickly, we see less severe impact compared to previous strains of the virus. As far as our business is concerned, we see good growth across the portfolio for our newly launched medicines, for our routine diagnostics business, but we do expect that the demand for COVID-19 testing will decline in the second half of this year.
Severin, as a global citizen, or all global citizens as well, can I just ask you what the ramifications are there? You were very careful there to say, certainly in Western countries, in developed nations as well, the WHO and others have pointed out very clearly that until the world, rather than just the developed world, defeats this crisis, this pandemic as well, we will still be in it, and there'll be other strains mutating and other problems potentially as well. What about your concerns, which you have, which are very real, about the emerging world and whether they are reaching a peak in cases?
Yeah, there is no doubt that we can only be successful in the fight against COVID-19 if we are successful around the world. The virus, as we all know, doesn't stay in a country. It's traveling across the world. And therefore, it's so important that vaccines get more available in the developing countries. And it's in our own interest here in the developed countries to make sure that supply is increasing in the developing world.
Just one from me, Severin. The quality of the test. I'm taking so many blooming PCR and lateral flow tests as well. My poor nose as well. I'm sure you're the same as well. We're all getting the same issues. Are you happy about the quality of the entire testing regime now, or is there still a lot of progress that still to be made and more discoveries and better processes?
I think this is a real success story. If you think about it, 1.5 years ago, we didn't even know that this virus exists. By now, we have not only developed, and by we, I mean the industry, not only have we developed a whole portfolio of very accurate diagnostic tests, PCR tests, antigen tests, antibody tests. We have also been able to ramp up production capacities in a record time. So the really good news is that now the world can be supplied with those tests, and that's a big difference if you remember back a year ago when there was such a shortage of supply for those tests. So a lot has happened since then.
Severin, what is the outlook, though, for the testing side of the business? Because, as Steve points out, more and more tests required, even if you're double vaccinated. Do you think this is going to be with us for months to come, despite the vaccine rollout across the world?
I'm afraid so. This virus will stay with us. As we know, not all people will get vaccinated, so the virus will stay with us. There will be mutations of this virus, and as a result of it, there will be a need in the future for new vaccines, for boosters, but there will also be a need for testing and for medicines. And that's also the reason why we at Roche continue to invest into our testing portfolio on the one hand, but this is the reason why we also are investing into new medicines in the fight against COVID-19.
I've noticed in the statement today you talk about some normalization in healthcare systems, but at the same time still point out that oncology has been impacted. Just give us a sense of what the normalization means for you in practice and what more needs to take place for the oncology division to pick up from here.
Right. We have seen negative growth in our pharma division over the last quarters. In the first quarter, it was still down 9%. And what we have seen in the second quarter this year is that sales are up by 4%. So you see a strong recovery here. I should say, however, that we are still not quite back to pre-COVID levels. So there's still a way to go. There are still patients who are hesitant to visit their doctor or go to the hospital. We expect that to improve for the upcoming months. But overall, clearly, the situation has improved, and we have seen a recovery in our business accordingly.
Let me give you a chance to talk about some of the portfolio rejuvenation, because as I look through the list of drugs, you've got double-digit growth in many of these big names. What are you most optimistic about?
First of all, we see very good momentum with the newly launched medicines, up by 30% for the first half year. This is pretty extraordinary. But what I'm actually most excited about is the progress we made in our late-stage pipeline. We moved 12 assets into phase 3 trials, which is pretty amazing. And we have now 18 new molecular entities in late-stage development. That's a new record for Roche, where we already had an industry-leading pipeline. So I think we are really well positioned for the mid and long term with this strong rejuvenated portfolio.